House Bill 4076. Imagine this. You have a family member who needs a life-saving organ transplant. They finally get on a transplant list, but the hospital tells them they cannot even be evaluated because they did not take certain vaccine. No discussion, no medical review, just an automatic rule. What the bill says it does? House Bill 4076 says hospitals and doctors cannot deny someone a transplant or drop them from the list just because they are unvaccinated. The bill claims to protect patients from blanket rules that ignore individual medical needs. What it actually does? It removes hospitals' ability to set one uniform vaccine standard for transplant safety. This means one doctor can now approve someone in their good faith judgment, while another doctor can deny the same patient for the same reason. It gives the Health and Human Service Commission new power to set statewide rules that override what transplant centers normally do. Now, who benefits? Patients who refuse vaccines, advocacy groups that push for vaccine choice, and doctors and hospitals who gain legal cover if they say they acted in good faith. Now, who pays the price? Patients on transplant lists who rely on consistent safety standards, hospitals that must manage uneven policies, and families who may face higher risks or longer waiting times because standards vary by doctor or facility. Why it matters. Organ transplants are some of the most complex medical procedures in the world. When rules change from clear and consistent to case by case, the people waiting for an organ are the ones who feel the impact. This is not just about vaccines. Once lawmakers start rewriting medical rules for political reasons, it sets a pattern that can spread into other areas of healthcare. Questions you can ask your lawmakers. How will the state make sure transplant decisions are consistent if each doctor can apply this differently? Why give one agency full power to set the rules when hospitals already follow national medical standards? Would you support a review clause so Texans can see how these changes affect outcomes over time? Bottom line, House Bill 4076 protects personal choice but creates uneven transplant decisions and shifts medical standards from doctors and hospitals to state politics.